we're all part of that same team, and we're all living out that same mission, and just to care and take care of our patients. Every single person is the patient experience. We all create that for our patients, every interaction we have.
Well, hello, everyone. Welcome to this week's episode of Let's Talk Solutions, Candid Conversations with Healthcare Leaders. I'm Amy Fritzer, Director of Business Development for HHS.
And I'm Becca Leaf, Director of Business Development for HHS. This week, we discuss how the patient experience is a really big deal in healthcare these days, and it's not just a frou-frou-y thing. It's actually really important and allows every aspect of a hospital's operations to contribute to the experience and perception to ultimately improve your patient satisfaction.
And our guest today is the very passionate Melissa Haynes, a patient experience director at Genesis PrimeCare, which is a large clinic system in East Texas. And she has over 20 years experience in working to improve the patient experience while collaborating with administrators and training team members.
Welcome, Melissa. Thanks for joining us today.
Hey, my pleasure. Thanks for having me.
Melissa, I know that you've worked, as a director of patient experience in both the inpatient acute care setting and a hospital, and now you've moved into the outpatient facility, still doing that patient experience. So you've really gotten to see how patient experience, patient care impacts both of these spaces, both hospitals and clinics. So what I'd love to hear you tell us today is a little bit of background on your expertise and what your experience entails.
Sure. Well, I started in healthcare back in 2003, I believe. I started as a student worker in registration, and that was when I was in college. And then I moved into the marketing community relations field right before I graduated college and stayed there through, I think, about 2013. And that's when I really went into patient experience. And so I've been in patient experience for about 8 years, maybe a little over 8 years now. And I love it, and I learn more every day. And so it's just a great field.
So can you kind of define what you mean when you refer to patient experience and kind of the components of patient experience?
Sure. So when people ask me, well, what do you do? And so in the outside world, I break it down and I say, well, basically it's customer service. But in reality, in healthcare, we know it's so much more. And so when we encounter our patients, their world has flipped upside down. They're in a vulnerable state. They may be in pain. They have some confusion, or they're scared. There's fear. There's a lot of uncertainty just because they don't know what to expect. And so It's so much more than just basic customer service skills, and it's really the experience that we create. But just if we think just customer service, we know that there are some people that are naturals at customer service. They wake up in the morning and they just have that spark, that energy. They love people. They talk to people at the grocery store, the gas station, and they just connect. And then some people, it takes a little bit more effort. So maybe 2 cups of coffee in the morning before they're friendly, and they have to work a little harder. And then there's people that they don't get it. They're not people. And those people, it takes so much effort for them. But our patients across the nation, they expect and they need that same type of communication from everyone they encounter. And so that's where someone like me comes into play.
Mm-hmm. You made a good point there. Like you say, like not everyone's a people person. And this is kind of stereotyping here, but typically, someone who's got like more of the science brain or is just extremely brilliant, like doctors and surgeons, some of them not always have the social side. I mean, sometimes they do, sometimes they don't, but that's just like the stereotypical piece. So I feel like in healthcare, more than anything, it's probably really helpful to have someone like you and a patient experience team come in and be able to help teach those people those soft skills that they may not have.
Absolutely. In fact, I had one surgeon tell me once that his patients and their families don't judge his quality by what he does in the OR. They judge his quality as a surgeon by how he treats them at the bedside. And that came from a surgeon. I went, wow, that is so impactful. Absolutely.
Yeah, big time.
Kind of reflecting on that, a couple of years ago, my mom was pretty ill and she ended up going into the hospital. And long story short, there was like no communication at all. She ended up being basically stored in the ER for almost 24 hours before she was transferred to a room. She couldn't really get anybody to help her. She And when she was in the room, she didn't get a lot of communication from any of the staff really in terms of what was going on, how long she was going to be there. It was like a very frustrating 36 hours. And she still said care was great. Pain management was fine. But she goes, the experience was just awful. And kind of what you're saying is no matter what level of care you get, if you don't have that experience or communication or, empathy and compassion from those that you're, vulnerable to, it kind of, doesn't matter,
In fact, when we talk about quality and quality measures and healthcare, and I sit through a quality meeting every month, we have quality in all of our management calls. We're not speaking the same language that our patients are when they're talking about the quality of the care they receive. So they judge the quality of the hospital or the provider based on what they know. And that's how we make them feel or the experience that we create for them. Right. In fact, I spoke to a friend today who had unexpected surgery over the weekend. And everything she told me about her experience was about how people treated her. She didn't tell me about the outcome of her surgery. She told me about how nice and caring and kind and compassionate. And she said every single person was like that. And so she talked about how they communicated with her. And I was like, that is it. That's exactly why I do what I do.
Right. Exactly. Because the average patient isn't trained to be able to even speak to what's happening to them medically to say, oh, he made a great incision or what have you. Like they're there to talk about the human aspect of it.
Absolutely. In fact, I have a mother-in-law who has been in healthcare since way before I was born, and she's been a nurse for 40-something years. And she's who we call when we need a translator, right? So when we have that medical information, we call and say, what did they mean by this? But that gets us back to what the patient experience is. And the definition that I've seen used the most is the definition by the Barrel Institute, and that's patient experience is the sum of all interactions shaped by an organization's culture that influence patient perceptions across the continuum of care. So basically, patient experience directly impacts patient engagement and their outcomes. It's so, so important.
Especially when you consider how many points of contact there are, right?
Absolutely. Every time we interact with our patient, we are either building our patient's trust in us or we're losing trust with our patient. And so we do talk about how it's the sum of all interactions. One of the ways I explain that when I'm talking to our new hires is if I was a baker, and I am not, and I was to bake an apple pie, and I went to the store and I got 6 apples, the perfect apples for this pie because it's someone's birthday and I want to make them a special pie. And I bring these 6 apples home and then I see that the recipe actually calls for 7 apples. And I look in my pantry and I have this rotten old apple over in the corner. And I should have thrown it away last week, but I never took care of that. And I said, well, I've got to have an extra apple. And so I throw that apple into the mix. The entire pie could be ruined. And so every single person is the patient experience. We all create that for our patients, every interaction we have.
So in your analogy there, the apples then, some examples of other people in the hospital besides the most obvious, which is doctors and nurses. I'm thinking housekeepers that come into the room, food and nutrition folks that might come up and take orders or deliver food. Yeah. Techs, like patient transport, like moving patients from their bedroom to get an MRI or lab work done.
Even facilities people, if they go in and like fix something on the bed or fix the toilet or something like that. I mean, when you think about it in terms of how many touch points the patient has in any given facility, that's a lot. So how do you do that? I mean, across the board, I mean, obviously you train team members and folks all the time, but in terms of all the other touch points that a patient may encounter, how do you manage all that?
So everyone needs to learn how to communicate with our patients. And let's not forget our volunteers at the front desk. And then billing. I mean, how confusing is a medical bill?
Yes, no kidding.
I've been in healthcare my entire adult life, and you send me a bill and I go, oh, I don't know what this means or what to do. And but also IT directly impacts patient experience because we utilize so much technology when we're caring for our patients. Anyone in radiology or surgery or the biomed guys that keep our equipment running so there's no delays when our patients need CTs. We all are part of that patient experience, but not only in the patient room or on the telephone, but think about our cafeterias. I've eaten in cafeterias in hospitals all my life, and there is a difference when you're eating as an employee on a Wednesday with your friends and your colleagues versus when your son's in surgery and you're trying to push a banana, just be like to get some kind of nutrition, and you can't eat because you're so consumed with worry. But that's interaction that we have. So our cafeteria staff interacting with the families in the cafeteria. It's so important in the hallways, at the bedside, on the telephone, in the elevator. Every interaction we have is crucial.
It is. It really is. So then, when it comes to training those folks and coaching them, I guess, because I think coaching is probably more so what you're doing. How do you tailor that to those different audiences that you just talked about?
So, one of the things I love to talk about, of course, in communication is how our verbal and nonverbal communication is so important. And then I sometimes I do have to tailor it to what their experiences are as employees. And so when I talk to our IT team in the past, I've listed the IT terms that I have no idea what they are. And so I Google it. And then we talk about how important it is to explain what we're doing in the world of IT so that the end user can understand. And so when we talk to our patients about a patient portal, we've got to explain it to where they can understand. So training from my aspect, we've done, of course, orientation. Everyone is all together on the first day. And so they all kind of get the same thing. But we talk, of course, about, patient experience, what our key initiatives are in that facility or that organization, and the expectations of every single person and how they all play in. However, it can't just end on the first day. So my husband can hear something and he never forgets it. And if I hear something and I don't write it down, it leaves my brain the moment it came into it, or at least in the next hour. And one of the things I do now is I teach orientation on Monday. I come in after lunch and I roll out our patient experience, our service standards, our values. And then I tell them, listen, we're going to talk about some things and you're going to forget this over the next few days. Orientation is overwhelming. There's so much knowledge you have to put in your mind on that first day. So I come back to them on Friday. So I see them twice in the first week. And I always say, okay, well, do you remember this or this? And sometimes I get the deer in the headlights look and I said, it's okay because I told you would forget. And so on Friday, we go into our skills lab. So we reflect, we tell again what the expectations are, and then we act out those expectations. It's awkward. And it's because I'm the patient and I'm going to come to you and you in front of everybody, you have to do your role, but it works. And we know that. And this is a quote I heard and I use it in my own family, but perfect practice makes perfect. So we don't just send everybody out and say, well, I hope you do a good job. We work over and over. And I can see that sometimes there's people that need a little extra help. And so we'll just practice until we get it right. But then that has to be a continual focus. It can't end in orientation. So we talk about our initiatives in huddles, in staff meetings, in management meetings. We talk about it daily, weekly, monthly, quarterly. And so it's constantly being talked about.
Yeah. So when you were talking about orientation, do you do that for any new hire, no matter what department they're in, or is it specific to those that have more interaction with the patient?
No. So it's everybody. And in the hospital setting, it was always everybody. It was their first day. They were all in there. We all have different roles, but we're living out the same mission. And that's the mission of the hospital that we're working at. And sometimes our paychecks may even come from different places, but we are all there. Yeah. And our patients don't know where our paychecks are coming from, but they see us and they see an employee of that hospital that should care for me. And so we are all in there together. In fact, at my current organization, our providers start an orientation with us on the first day, and they get everything that all of our employees get as well.
Wow. That's awesome. Because then you have a unified message that you're delivering to the patient too.
Yes. And not just from the patient experience standpoint, but the other things about who that organization is as an entity, their beliefs, their values, their goals, their service standards, all of that ties into why we all come together on the first day of orientation.
And I think that's especially, you mentioned it talking about, no matter where your paycheck comes from, but I think it's especially important for those outsourced services to get that orientation at that facility, because they might work for a third party company to I don't know, do food service, for example, but they actually work for your hospital. Like as a patient that comes in, I can't tell whether you work for a third party or you work for that hospital. And like you said, like that unified front is just so extra important for those outsourced people, I think.
Absolutely. And then also showing our appreciation. And this is something I've always tried to do is during appreciation events is that we serve everyone, all of our employees, no matter who, where you get your paycheck or what vendor you are. We're all part of that same team, or we're all living out that same mission, and just to care and take care of our patients.
Obviously, our number one goal is to care for the patient and, for their healing. But how else can a positive patient experience actually impact the facility?
I've always worked in a hospital or now in a clinic setting. And so it's my comfort zone. I feel comfortable walking into the front doors of the hospital. It's not a scary place for me. But I know that's not the case for my patients coming in, or even when we as healthcare workers, we may work at a facility for 26 years and then all of a sudden we're a patient. It becomes different. So I've always known that patient experience is important because of my role. But I've learned because of my experience of how crucial it is. And so you shared about your mom. Back in 2019, it was December, I was at my husband's grandfather's 90th birthday party, and I get a text from my mom that she's taking my dad to the emergency room. And so then later on that evening, that's why they didn't come to the party, I find out that my dad is being admitted into the hospital. And he ended up in ICU with pulmonary embolisms and a saddle pulmonary embolism. Now, remember, I'm not clinical, but we knew at that point, and from what we were being told, my dad may not leave that ICU, not with us anyway. And I've never been so afraid, so scared. So I didn't know. And we were having to make these decisions, but we weren't receiving the communication that we needed. And there we were with people that I'd been investing in for many years. And it was just such a scary time. And I realized at that point that everything I had done was not in vain. And I was seeing the fruit of my labor. There was a nurse that cried with my dad one night because my dad was in ICU, in a 4-person ICU. And if you looked at him, he felt fine. He looked fine. But we were told if he stood up, one of those clots could break away and he could drop at that instant and he would be gone forever. And it was a scary time and it was overwhelming for him, for my mom, my sister and I. And it was that moment that I said, what I do is so important because I saw how much my dad needed that communication. You live for when doctors make rounds, when you're in a life or death situation, which we thought we were. And I even, thankfully, I've been in healthcare for a long time, so I know the experts, and I called some experts, and they broke it down for me in a way that I could understand because I'd never heard of a saddle PE. I didn't know what that meant, and so it was just so important. And you don't always get to see how one day in orientation and teaching people how to communicate really plays a role until you're sitting by your dad, not knowing if he's going to make it. And it was at that moment, I was like, this is important. So yes, it's important for our value-based purchasing. It is important for so many things.
HCAPS too, right?
And for the hospital financially, but it's important because we're caring for human beings. We're caring for someone's most beloved person. We're caring for someone's daddy or their mama or their son. And so I'm very passionate about what we do, and it all comes down to communication. And I'll tell you, I've been very data driven, HCAHPS data over the past 8 years, but I remind myself that behind every survey answer, every number, every statistic I see is a human.
Yeah,
and it's someone's most beloved person. And numbers can be numbing at times, but when we see
and misrepresentative, by the way.
Yes, we know that numbers don't always tell the accurate story, but we have to let it renew our urgency. And one of the things with HCAHPS, I look at the data, and one of my most favorite things is the voice of the patient, where patients have the opportunity to compliment a caregiver by name. Now that to me tells a story. And when we can really see what our patients thought about their visit, and especially over the past year, when people are said, I was so afraid to come in, and they'll just list people by name, that made them feel comfortable, made them feel like they mattered, and made them feel safe. And that's really where I'm driven, is by those comments. But we also know that how we treat our patients is important, just like any other industry, customer service, patient loyalty is crucial. And so every interaction that we have, we're building that trust or we're losing it. And I don't think there's a CEO out there that says, you know what, if we lose, 20% of our patients, that's great. No, we want to keep our patients. We want them to choose that they want to receive their care in our facility or by our providers. And so that's another reason it's so important.
So obviously the number one reason for patient experience is because the patient comes first. And I think most administrators that get into the profession have a soft spot, have a true, purpose in life to go out there and serve in healthcare, because they want people to feel better and they want to make a difference within the healthcare space. But they also have to run a hospital, and they do have to look at that data, like you said. But I loved that you said there was that open field question, and you like looking at those answers, because like we said, we don't know if every hospital does that, but I think every hospital should, because to Amy's point, those HCAHPS could be a customer saying, well, I'm frustrated about this one thing, so I'm going to score you really low. Well, now you're not getting the background on that. And this reminds me of that story you were telling us earlier, Melissa, about the mop. And this is where an open field would come in, because you can learn from, okay, this is what that person actually means. This is what the miscommunication broke down. This is how we can now improve as a hospital and not have this happen again. So would you tell that story again?
I was just going to say, tell us that story. I love that.
Yeah, absolutely. So before I was in patient experience, I was over a volunteer program, and we had volunteers that would round on our patients, and just they were ambassadors for us, and they would just go see how the patients were doing. And one day, a volunteer came back and said, well, this patient's complaining because, we haven't mopped their floor. So of course I went to the manager and probably that unit or housekeeping. That was over 10 years ago. So I don't really remember who I went to, but what we did to fix it without fixing it correctly is we sent in someone with a mop. Right. So we sent them in with a string mop. In healthcare today, we use mops that look like Swiffer sweepers. And we do it for infection. Yes. And it's for infection control practices. Right. But we sent someone in with a string mop instead of telling her what we're doing when we're in her room and why we're using that mop. And we just tried to show her that we would mop. So a few days later, her complaint was, well, they haven't mopped my room since I complained that one day. And so it's so important that we break it down for our patients and that we really explain what we're doing when we're in their room and why we're doing it versus just skipping over that. And that was way before my patient experience days. And so if I had been where I'm at now, I would have known how to fix it. Well, let's go talk to this patient and show her and why we use that. And it's for her safety and for infection control. And then she was bedridden, so she couldn't see the wet floor. And it's just, that was a good learning opportunity for me.
And how does that tie into AID-IT?
Absolutely. I've implemented that in a hospital setting and then now in the clinic setting. And of course, it was established by Studer Group, but it is used across the nation by hospitals, healthcare providers as a framework for communication. And it is a proven mechanism or framework for our patients to receive the communication that they need.
Can you explain what it means, what the acronym actually means?
Oh, yeah, absolutely. So there are 5 elements of AIDET, and it's AIDET. They acknowledge, it's introduce, duration, explanation, and thanks. And so every single element is crucial. They're not all utilized in every single interaction, but the acknowledge piece is just the greeting the patient, right? So that's that first impression. And we know first impressions that lays the groundwork. Our attitudes and our first impressions really impact the patient's experience. So acknowledge and the introduce is where we tell our patients who we are, what we're doing for their care today. And I used to say, and why we're in their room, right? With who we are, what we do here, and why we're in their room. And there's so much fear when you're in the hospital. And when you don't know why someone's poking and prodding on you or stealing your trash or whatever it is that they may be doing,
or not mopping your floor.
Well, there's more fear in that. And so when we tell our patients who we are, what we do here, it helps eliminate those fears. And anytime we can take away fears for our patients, it helps them become more engaged in their care. And also through the introduce, we have the whole managing up scenario, and that just builds our patients' trust in ourselves and in their next care provider. So D is my favorite one. It is my favorite element. It is duration, and there is nothing like waiting when you're waiting in the doctor's office or when you're waiting for that surgeon to come in or you're waiting for your meal or whatever it may be. But what I love about duration is it helps us manage our patients' expectations.
Yes.
So if there is a delay, then we talk to our patients about that. So if I show up, it's for a 2:15 appointment and I haven't been seen by 2:45, I'm pretty frustrated. But if I show up for my 2:15 appointment and I'm told that and this has happened to me before, that my OB had to go to an emergency C-section, then I have and he's running behind, I have a little bit more empathy, because let's say I was 37 weeks pregnant and in 3 weeks, I may need him to run over to me. I mean, that has happened to me twice. And once that office didn't use AIDET. So I just sat there and I waited, and I remember texting my husband, my time is important too. Like, there is no one in this waiting room.
And you're mad. Yeah, exactly.
Yeah, I was so frustrated, and I was very pregnant, and I just added to my frustration for waiting. And then finally, when they told me, I thought, well, why didn't you just tell me 35 minutes ago?
You're like, now I feel like a jerk. It's okay.
And then one day I was driving to my doctor's appointment. They used AIDET for my second child. And they called and said, hey, we just want you to know Dr. So-and-so is still at the hospital. He had a delivery, and so he's not even in the office yet. It's going to be, probably 30, 45 more minutes. And I was like, oh, okay, because I was running behind anyway. And I was like, I can go get a bagel and cream cheese before I go. And had I showed up and had not eaten,
you would have been hangry.
Yeah.
Yes, because it was early in the morning.
A hangry pregnant lady is not good.
Absolutely. So duration is my favorite because we can manage our patient's expectation and keep them from the fear and the anxiety of waiting, and also the frustration. And then, and I have to manage my kids' expectation anytime we go into a store. We are here for groceries only, and we are not getting a toy. So I always use that little element in my personal life. E is for explain, and that is where everything we've been talking about all comes in. And so we explain what we're doing, why we're doing it, in a way the patient can understand. Because if the patient can't understand, we might as well not even tell them. Right? Because it's just a different language for them. So we have to break it down in a way that they can understand, versus using a string mop one time versus just explaining in a way that lady could have understood. And the T is just, it's thanks. I love it because it shows we appreciate our patients, and it just also just wraps up a conversation nicely. It wraps up our interaction nicely as well. So it it is something we use, but we can talk about using AIDIT all the time. But if we're not rounding and observing, then it's not happening.
Yes.
Probably not happening, right? So if we permit it, we're promoting it. And so that is something that we do. We round and we watch and listen for AIDIT. I'll be out in clinics next week doing that as well. And so definitely accountability is crucial.
So how do you measure that?
Yeah.
Well, I would say lots of people do it differently. I have a progress note that I use. Maybe it's progress note because we're in the hospital setting, but I know some people will have skills labs where everyone comes through and maybe they put a manager or a supervisor in the bed as the patient and they kind of do it in a skills lab setting. Or when I was in the hospital setting for our standards or our expectations that we had, I was rounding early in the morning at shift change and listening and watching. And one of the things that I love to do is in my coaching is when I'm watching, I'll say, okay, well, what do you think you did well? And I'll listen to it in their terms and let them say. Sometimes I'll hear, oh, I don't really know. But then I'll push. I'll probe a little bit more. No, you did great things. Just what do you think one thing is that you did well? And they'll say what they did well. And then I'll say, okay, well, what do you think you could improve on just based on that interaction you just had? And they'll say something and typically we're more critical of ourselves. They always have something they could point out they could do better. And I'll agree or I'll kind of throw some ideas out there as well. And then we'll decide on one focus factor for them. And if I can get them to say it in their words, there's more buy-in. And so that's more of a coaching setting.
Yeah.
Now in the clinic setting, one of my most favorite things to do is we teach a 4-part greeting. So when we answer the phone, it's a 4-part greeting that we have. And I love in orientation when I'm teaching this, I say, okay, well, let's try it out. And we will call one of our clinics. We'll just pick a clinic. If someone's going to a certain clinic and they want to call that clinic, we will call that clinic and see if they're using all 4 parts. And they get to hear it in action and it resonates. Yeah, well, typically they do a great job. And it'll resonate with the new hires a little bit more. Mm-hmm. But I also do a lot of mystery phone calls as well. I love mystery phone calls.
Do you? Mm-hmm. Do you put on different personas or accents?
I do. I typically am new to the area and I need to know something from my grandma or my mom or my parents are actually patients of ours and they'll always call me and say, well, this happened or this didn't happen or, oh, I'm so impressed because my mom over the last 2.5 years, I've explained to her, since she is my mystery patient a lot, what our expectations are. So she'll call me and let me know if they're met. And she gets so excited when they are. And I'm like, yes, that's what I do. It's fun. But
she's a little spy.
I know. She loves doing that.
But if she's not treated in a way our expectations are, then our other patients aren't receiving that same expectation that we have. And so I love to use mystery patients that I know because I know I'll get the truth. And I also refer a lot of my friends to our providers. And I'll say, but I would love your feedback and I'll get it. And if there is an opportunity for improvement, that's what it is an opportunity. It's never, oh, why can't we fix this? It's okay, well, let's get this done for the next patient. And I love that.
Right. Because communication is so subjective too. Like, you're constantly going to be having to adapt, and that constant feedback from the patients that go in there is so helpful because the way that your friend perceives something might be totally different from the way your mom perceives something, and getting that feedback is very helpful.
Absolutely. But that's why we have our behavior standards that we must do for every patient every time. And also that's why we utilize that framework for communication AIDIT, because those are proven best practices that every patient expects. And it really helps us meet those needs and eliminate that fear. And it's directly tied to patient engagement and patient outcomes.
Mm-hmm. So when you guys are doing that, are there like certain keywords or phrases that you tend to kind of, coach them into using more, obviously specific in healthcare? Or do you guys just kind of wing it as long as they follow AIDIT?
Well, and I may be different than a lot of people. I'm not a big fan of scripting because I feel like we're human beings caring for human beings. We're not robots. They're not robots. There has to be some personality into it. But I am when we need to have keywords, there are keywords that we use. And so there, of course, industry wide, we've been given keywords to use during different interactions. But a few months ago, probably, I was called in. We were changing some practices in one of our offices. And so we knew that we were going to have some questions. And they called me and said, "Melissa, we're going to need some keywords from you. Our frontline staff, they need to know what to say." And I was sitting in my office and I thought, well, I don't know what they should say. And the reason I didn't know is because I didn't know what the patients were going to ask. I didn't know what their frustrations were going to be. And so I said, well, is it okay if I go spend a day or half a day in that clinic and find out, answer the phone, see what's being asked, listen to the patients. And so before I could create what I called my talking points about this situation, I just went and spent time. And I sat there with the frontline staff and I observed and I listened, and that they were able to tell me what questions may be asked, what questions had been asked. And so I said, okay, I think we need to answer this and we need this. And then I had to go get some of the answers because I didn't have all the answers. And so I met with our senior leaders, got the answers I needed, and I was able to give our staff the messages that they needed to give, but then they have to be able to take those messages and personalize them. Right. So if they're reading from a script, that's not as impactful as having a conversation. And we know, and my HR director says this all the time, it's a quote she heard, but the conversation is the relationship. And so that just is so important, how communication is. And I know some facilities use scripts and that is okay. But I would much rather train my team to be able to use keywords, but in a manner that is impactful and resonates with the patient.
Natural jargon.
Yes. And we know not everybody is natural. So, but the expectation is that those people who it doesn't come naturally, well, we can't just wave that off and say, oh, well, that's just so-and-so, she's great at this skill, but her face just always looks grumpy. Well, we get a lot of complaints on her grumpy face because the perception is that she's grumpy. So she needs to, or her voice is that people perceive her as rude. So we have to work with her to change those skills. And if we don't solve it at that point and have those conversations, then we're just permitting that, and we're not holding people accountable, and we're not going to see the results and the outcomes that we need to see in our patient experience, be it scores or just complaints or whatever it is, feedback we're getting from our patients.
So that was kind of one of my own personal questions then. So if you have someone that's like that looks grumpy, or maybe you're having to coach like a doctor because you're told like, their bedside manner is not great. What do you say to them?
I will say where I'm at now, our providers get amazing feedback from their patients, and they're meeting their goals. I'm like, woo, high five, virtual high fives to all of them. But when I have, let's say, an employee that gets complaints, and then their manager reaches out to me and they've already coached them on, this is the complaint we received and we're going to send you to Melissa for maybe some more coaching. So I start my session I like to do it one-on-one, not in their environment, right? Because then everybody's watching. Yeah. So in my environment, then I like to say, well, why are you here? Why are we meeting? And I have to get it in their words. And then I don't know how I do this, but it's just something I love to do. I help turn that into from they just think they're being picked on or it's punitive, into, hey, from the eyes of the patients, here's what they see. Here's their perception. And then we get a focus point. And we have a couple of things. Here's some pointers. Here's what will help you. And then they go forward. And if they really do want to change, then they do. And in fact, do we have time for me to share a story?
Yeah, of course.
So we had a nurse once who had been a nurse for a long time. And we would get complaints on her that she didn't know what she was doing. She just didn't know what she was doing. She wasn't good at what she was doing. She wasn't competent in the care she was providing, and she was rude. And so, of course, I was like, oh, well, we can't have nurses like this, So I brought, of course, her manager sent her to me, And I was ready, just gung-ho, ready to fight it out, right? Because you've got to be nice to patients and they don't think you know what you're doing. And when I said, well, why are you here? And she explained it, I noticed something. She didn't have good eye contact. She couldn't look me in my eyes ever. And when someone can't look you in your eyes, you think they're either lying to you or they don't know what they're doing.
Or they don't care.
They don't care. Yeah. And so when I started talking to her about this, I learned that it was her raising, that she was taught it was rude to look someone in their eyes. And so
Interesting.
Yeah. And so when we started working through it, this individual had been a nurse for longer than I had been in healthcare. So I knew she was competent and I knew she knew what she was doing. And once I learned it was a body language issue, it was so hard of a habit for her to break.
I bet.
And so I couldn't say, well, you need to have good eye contact because she was raised not to have good eye contact. So I had to undo.
Did you guys have stare-offs?
No. What we did is we broke it down. And I said, when you walk into that room at bedside shift report, I want you to look into their eyes and I want you to introduce yourself.
Oh, I bet she felt so awkward.
Yeah.
No, it was painful.
Yeah.
It wasn't awkward. It was hard. But she had to take the effort and we had to break it down into baby steps. And so we met, I don't remember if it was weekly or every couple of weeks. But I noticed a change and she would even stop by. She was night shift. So she would stop by my office a few times on her way out the next morning and she would share stories of me. She worked hard to undo those habits. And instead of getting complaints, I started seeing her name and compliments. And I'm telling you, that is so rewarding. And it was rewarding for her because she wasn't having to deal with complaints.
Right.
And it was rewarding for the patients. And we would discuss things like patient fear. And she was a night shift nurse. And there is nothing scarier than a hospital at nighttime when you're by yourself.
Oh my gosh. Yeah.
There's
and your visitors are gone.
Fear.
Yeah.
Yes. And it's quiet and people aren't checking on you every 25 seconds. And so we were able to just talk through the fears her patients may have. And she was able to share a story when she spent some extra time with the patient and she realized how fearful that patient was that evening. And she was able to help eliminate some of that fear.
That's cool.
And that, so when I do have people like that, I try to see the best and I try to help them through. And a lot of times it's just communication skills.
Right.
And so I really try to just help them through that. And I love it when there is an aha moment, when the light bulbs go off and they see it from the patient's perception.
Right.
And it's just different. And I love that.
I feel like that's an HR capability too, because that person is good at their job. It's just, you have to dig in and find out what is the root here? Like what's really actually happening? She's getting all these complaints. So that doesn't mean she's bad at what she does. There's just this one thing and you dug in and found that. So you didn't have to let her go, which is awesome.
Well, one time I was at a conference and I heard this phrase, sometimes you need to weed your garden for the flowers to grow. So sometimes there are people who aren't willing to make changes. There are the weeds and your good employees aren't developing because of that other person. And so I do work closely with HR, but sometimes I tell HR, listen, I've done everything I can. They're still choosing not to change their behavior.
Yeah.
And so, my HR director's calling me now, but absolutely. So it is something that I do work closely with HR, and sometimes people do want to change and they get it, and then sometimes maybe there's an opportunity for them elsewhere because it's not the right fit.
Well, to sum it up here, would you for folks that are listening to this, maybe it's somebody that is building out a patient experience program for the first time, or maybe they already have a robust one in the mix, but they want to be able to make some changes and upgrade a bit. What are your first 3 tips that you would give those folks? Very, simple tasks that they could take away.
It's three quotes I've heard. So one of my old colleagues, he said on his little social media account recently, he said, you can't eat the recipe. And meaning from that, you have to be able to execute and follow through, right? So you have to have the vision and you have to have the direction, the recipe steps, but you also have to be able to create the meal. And you have to have the ability to execute and follow through and then hold everyone accountable. So you're going to check the temperature of the meat. And then the second one that I just heard this summer, or actually this spring, is don't be a squirrel in the road. I heard this from a fellow chamber board member, and I had never heard that in my whole life. She said, well, we're just a bunch of squirrels in the middle of the road. And it's because we were planning an event, but we were struggling with where we wanted to go, and we were flipping back and forth. So don't have a flavor of the week or a month. Don't just shoot off and see what sticks. Follow through, pick one thing and execute that well before you move on, and always refer back and see if it's going well.
That's a really good one.
My third thing is something I teach all of our new employees, and I always make them share this with me. Remember your why. So when the going gets tough, and it's going to, remember why you're passionate about patient experience, or just why did you go into healthcare in the first place, or why did you choose where you work? And I always go over that with new employees, because there's going to be hard days. In the patient experience role, there'll be critics. There'll be people who don't believe the data or try to tell you the data is not right, or people who think patient experience is fluff, and it is not. It is outcome driven. And so always remember your why. In fact, we were interviewing for a position about 2 months ago, and we asked this employee, one of the questions is, how do you handle a hard day? And she said, I just remember my why. And then she explained that. And so one of my coworkers looked at me, and I was like, And I'll tell you, that individual is hired now. She is an employee of ours. And so you just have to remember your why. So can't eat the recipe, don't be a squirrel on the road, and remember your why.
That's awesome. That's great advice.
Yeah.
So the answer of, having a glass of wine wouldn't suffice for that answer, Melissa?
So mine is I typically am a stress eater, and I will go eat Mexican food. Or when I was pregnant with my son several years ago, and I was having a hard day, my husband would just say, "I'm gonna go pick up fish." And at the time when I was pregnant, I loved fried catfish, and so he would just, and still sometimes today I'm like, "It's been a hard day, I'm gonna go get some fish."
I love that.
And so he will get me fish, but I'm trying not to eat too much fried right now. But yeah, it's just that's so important. Remember your why. So important. Yeah.
I love that. Okay, so we close this out. It's just our little fun question section. So are you ready?
I'm ready.
Okay, so this is would you rather. So would you rather travel back in time to meet your ancestors, or travel to the future to meet your descendants?
So my parents say being grandparents is amazing, and I think I would just want to go see all my grandkids.
Oh,
right,
okay.
in the future.
And would you rather lose all your money or all of your pictures?
My kids are so cute. Probably my money. Money, yes.
Wow.
Lose my money.
Wow.
Spoken like a true mom.
Yeah, exactly.
They're so cute, though.
Would you rather have invisibility or flight?
So invisibility, because my 8-year-old would not think I was cool if I chose flight over invisibility, because he is a huge Harry Potter fan. But there's a lot of risk with invisibility. I mean, what if people are talking about me? Yeah. And then I hear it, and then, there went that relationship. So probably invisibility to be cool with my kid.
Oh, okay. Well, that's a good one. And this is one of my favorites. I might answer this one too, but would you rather live where it only snows or the temperature never falls below 100 degrees?
100 degrees, because I live in Texas and it snowed, and I was snowed in with those beautiful children of mine for an entire week. And I thought, no, we got to get through this. And so I got to get back to work. So definitely 100 degrees with a good air conditioning unit. Good air conditioning.
So when it snows, you weren't thinking they were so beautiful after a week, huh?
Well, the 8-year-old, he went outside and played, but the 1-year-old, he wanted to go outside, but he didn't want to get dressed to go outside. Oh. So, there was a day that was below freezing, or temperatures I'd never seen in my life. And he just wanted to go outside in his pajamas, barefooted. And I was like, we cannot, this is not happening. And he would not get dressed. So then we were just standing at the door screaming. Yeah, that was a trying week, but we made it through. And my husband's in the electricity business, so he wasn't here to help me.
Oh, no.
And it was a week. It was a long week, but we made it.
Well, as one I was born and raised up north, and been down in Texas now for a long time. And I can honestly tell you that I would rather be where it's 100 degrees any day of the week and twice on Sunday rather than be in the snow.
You're a good person to ask that, Amy, because you have done both. I forgot.
I've done both. Yeah. I'm happy with the warmth.
Can I just share one more thought?
Of course.
The most important message I think I could share is just show appreciation to your staff, to your team. Because if we take care of the people that are serving the patients, then they're going to take care of the patients. But we have to take care of our employees. We just it's so important just to show our appreciation, like, verbally, and tell them why we appreciate what they do. It's just really, it's meaningful. And it is a hard industry, and our frontline staff, they need to hear thank you and the why for that thank you.
You get empowered that way.
Yes.
Yeah.
Appreciation goes a long way.
Well, we appreciate you, Melissa.
Oh, it's my pleasure. Thanks for letting me share a little bit of why I love patient experience and why it's so important. And it's not fluffy. If anyone hears this, they need to know it is not about filet mignon and VIP parking. It is communication and outcome driven.
Yes, 100%. I think you conveyed 100%. That big time.
Good. Okay.
Yeah, I'm not sure people know where you stand at all on this issue.
Maybe we'll do a follow-up.
Yeah.
Thank you all so much.
Yeah, thanks so much, Melissa.
Thanks, Melissa. I think my favorite part of that was how she gave so much personalized stories behind it. I love that she gave the actual examples of how she talks to people and coaches them.
Yeah, and you can tell that Melissa's got a lot of passion and compassion for what she does. And it seems like she's the perfect fit for someone that can explain patient experience for anyone on any level, and no jargon included. And then you can obviously tell, like you said, based on the stories about, the feedback she'd gotten from nurses she worked with or other team members she'd work with, that the fruit of her labor is successful, and she's very successful at what she does.
Because I think I feel like if I went in and had a consult with her because I was getting feedback that I needed coaching, I wouldn't feel like I needed coaching after talking to her, because she would make you feel like you're the most awesome person in the world while also getting you to make changes. You know what I mean? Unless
she brings out her mom voice, then I might be a little worried.
Yeah.
But yes, I agree.
That she was talking about.
Yeah, I know. Yeah, she was great.
Well, thanks y'all for joining us for this candid conversation about the importance of patient experience and perception.
Yeah, and thanks again to Melissa for joining us. And thank you all for listening. We hope you've learned something new today.
Be sure to follow us and tune in for our next episode with another healthcare leader, wherever you listen to your podcasts. And for more tips in healthcare, follow the HHS blog at www.hhs1.com. Until next time.